Morning. Good morning. Good morning. Good morning. Thank you for being here. We are um, we are the community of engagement, and we do engage. So you must engage with the people close to you, and always. And my name's Judith Farber Weissman. I am thrilled that you are with us. I'm thrilled to have Ken with us today. And his wonderful partner is going to introduce him. And I now give you Judith Pact.
I have to do mine too. Hello. This is such a small group. Do I really need this?
Yes. It's on.
Is it on? It's on. All right. My eyes are weeping. Since you put it right close to my face, since you all know Ken so well, I hardly even need an introduction. But Bert is giving me a face, so that means I better do it. Ken's background, I think you know, he went to school and college in Minnesota, and then he went to Oxford, and then he went to MIT, and then he ended up at what he always wanted to do was to be a doctor. So he went to the Barnes School, medical school, in St. Louis. Barnes, actually it's not the Barnes, it's Washington University Medical School, Barnes Hospital. And in the course of his time as a medical student, he looked around and he saw this group of people. Half of them were smoking, and the other half were sleeping. And oh, maybe they were drinking earlier. Anyway, he got interested in it. He then went on to graduate work after his medical degree at Albert Einstein in New York, where he was very seriously involved in pulmonary medicine. And then on to San Francisco, University of California, more serious. And that was when I think he really developed his interest in sleep. I don't think I want to say much more than that because it's Ken's to say.
Does he want? Is his on?
Is the microphone on now? So as the first slide reminds me, is that better? As the first slide reminds me, before I start the real talk, I wanted to do a little test with you. Nobody has to participate, but if you want to, on the right moment, raise a hand. So there'll be three questions. The first question is, has anybody here felt unusually sleepy at a time when that person couldn't figure out, what the heck, why am I so sleepy? Anybody had that experience? So pretty close to half the group, or maybe even more. Second question, has anybody had trouble falling asleep when they thought they should be able to fall asleep? About the same number, maybe a little less. Third question, has anyone personally experienced or been told by a bed partner that they're doing something really strange in their sleep? Okay, that's a smaller number. So I think we can all agree there are a lot of people who have sleep issues. And that was the point of the question. I didn't hear you. Oh. I think what I'll do is take it out of its cradle and tell me if that works well. Much better. Okay, good. Okay, now if I can be sure I understand how to change slides, we'll be in good shape. Here we go. Okay, so this is a talk prepared mainly, or especially, for people who've had experience trying sleep for a few years. That would be most of us. The next slide is going to remind us rather, how sleep was viewed for most of known history. I'm having trouble finding my cursor. There we go. So when one thought of a person asleep, one thought of someone who was quiet, motionless, not very responsive, possibly breathing, but sometimes breathing so shallowly that a casual observer wouldn't be sure whether that person was really breathing. This difficulty in easily distinguishing between being asleep and being awake led Shakespeare to incorporate that problem into the play Romeo and Juliet. You probably all recall that Juliet has been drugged by her priest to escape a marriage she didn't want to be part of. And Romeo comes upon her, finds her so deeply asleep, he thinks she's dead, and he commits suicide. Thereafter, she awakens, and she, finding him truly dead, also commits suicide. So that's the tragedy, and it was a reflection on the difficulty of distinguishing sometimes between deep sleep and being actually not alive anymore. So let's see if we can advance to the next slide, if I can figure that part out. Let's see if there we go, that'll work. Okay, so what is the difference then, or what are the main differences between being asleep and being dead? When we're asleep, we don't cool down to the room temperature. We maintain our body temperature. Our heart continues beating. We're breathing, sometimes so shallowly it's hard to tell. And not only do we wake up spontaneously sooner or later, but we can often be awakened by someone shaking us or talking, whatever. So the body's very quiet during sleep. What about the brain? The opposite is true. The brain is extremely active during sleep, and I'm going to show you in a moment what that looks like. Despite the fact that the brain is very active throughout sleep, we lose access to our senses. Once we fall deeply asleep, we don't hear, we don't feel touch, we don't detect lights going on and off. It's a genuine loss of input from our senses. So what is happening during sleep? When we become drowsy, our eyes begin to roll slowly back and forth. That's the most common. Sometimes they roll up and down, but mostly it's horizontal movement. That's not yet asleep, that's drowsy. Once we get into sleep, stage 1, and there are basically 4 to be discussed, once we get into stage 1 sleep, we're still aware of sounds. We can tell if someone turns the lights off or on. We can keep track of time roughly without even looking at a clock. And we can have reverie-type thoughts. And that only takes 5% of the night. We recurrently go into stage 1 sleep because we recurrently change stages throughout the night. Once we get into stage 2 sleep, all bets are off. And stage 2 typically takes about half the night. We have no awareness of our surroundings in stage 2 sleep. Stage 3 sleep, which occupies perhaps a quarter of the night, is in many ways the deepest stage of sleep. A person who's awakened from stage sleep and asked what they were thinking or what they were dreaming has no answer. They have no idea. We don't know whether that means they weren't dreaming and weren't thinking, or whether they simply can't get it. They can't pull it out. We don't know which of those is true. Then there is stage REM, which stands for rapid eye movement sleep. The eyes go bing back, bing back, bing back throughout this stage. This is the stage of dreaming, and roughly half the time that we spend in stage REM, we are actively dreaming. The dreams of REM are different from dreams in other stages of sleep, but I don't want to bother with that, at least in this part of the talk. Later, if you ask questions about it, of course. So this is what sleep scientists study when they're studying someone who's sleeping. This is the pattern obtained from electroencephalograms. Basically, the EEG is done by attaching electrodes to the scalp in predetermined positions. They're the same for everybody. And the top line shows you what's happening when someone is awake. The brain waves are they are basically electrical discharges from the nerve cells, so-called neurons. Each cell can discharge. As you notice from that top line, the discharges are relatively short. They're not very tall. That means the voltages are pretty low. They're chaotic. You can't predict when the next one's going to come. And they're variable. They go shorter, taller, faster, slower. It's a chaotic pattern. That's not asleep. That's stage one. I'm sorry, that's awake. The next line, second one, shows stage one of non-REM sleep. And the thing that distinguishes that from being awake is simply those theta waves boxed in the red square, or not square, but quadrangle. And those are slower. And so someone trying to stage your sleep during a sleep study will notice those occasional slower waves. And if that's the only difference from the awake pattern, they know you're in stage one sleep. In stage two sleep, there are two different features, and I've drawn them, or rather shown them. The sleep spindles are bursts of faster activity. Instead of 5, 6, 7 beats a second, these are 15 beats a second or thereabouts. Those are the spindles. Then there are the giant electrical discharges, much taller and much slower. What those represent is coordinated discharges of large numbers of brain cells. Bingo, a large group fire off together, and then they're silent, and then bingo, they fire again. So that makes stage two recognizable. Stage three is like stage two in the K complex, but these very tall waves occupy most of the time, at least half of the time. Those waves are giant, which means cells are firing in concert. Something has organized them to discharge at the same time with large groups of others. Finally, at the bottom, you see the REM pattern, which is basically the same as the awake pattern, although it's the behavior during REM is entirely different in this way. During REM sleep, our muscles, our voluntary muscles, any muscle we can choose to move, that muscle is paralyzed. And that's by design of the Celestial Planning Committee, thank you, because if we have dreams that are violent, we really don't want to be dashing out of bed while we're asleep and bumping into the wall or hitting our bed partner. So that's how we detect which stage of sleep is which. Sleep, can we hold the questions till after, would you mind? Thank you, Judy. Linda, sorry. Sleep has always been dangerous. If you think back to the time when we all lived on the savannah in Southeast Africa, there were wild animals wandering at night, very hungry, and we smelled good. So it was dangerous to sleep. We were not as alert. We couldn't run away as easily. So why is sleep so common? Why is sleep the part of every known animal, and in large part, almost all plants, possibly all? So what uses sleep? You know most of this. It restores your alertness. It restores your energy. It's very helpful in combating both infections and cancers. It supports healing if you're injured. If you're a teenage athlete, it protects you from being injured. Kids without enough sleep get injured far more often. And most importantly for our age group, it supports new learning. We'll come by that another time. So what can go wrong? There are more than 100 now known different kinds of sleep diagnoses for problems. But they fall into 3 categories. 1, people who can't sleep or think they can't sleep. 2, people who can't stop feeling sleepy. And 3, people who exhibit unexpected, sometimes really weird behaviors during their sleep. They may be totally unaware of them. A bed partner usually is not. So what do you do? Can I be heard anyway? Okay. So what do you do if you feel like you can't sleep or you're not sleeping the way you'd like to? Number 1, make the conditions in your bedroom as close to perfect as you can. We'll come back to what that means in a moment. Secondly, assume you will fall asleep. Don't assume you're not, because if you assume you're not going to fall asleep, it'll be a self-fulfilling prophecy, because you increase your anxiety, and anxiety does not lead to sleep. Next, if you have a clock in the bedroom, turn it so you cannot see it. Make it face the wall and don't reach out and turn it around. Why? Because if you do look at the clock, what's going to happen? You're going to say, A, oh my gosh, I've been rolling around here for an hour and a quarter, blah, 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 blah. Or if you were still working, which most of us are not, you might say, I've got to get up in 27 minutes, or maybe it's only 2 hours. Whatever it is, none of those is conducive to sleep. Another technique which helps fall asleep for those who have trouble is to take a warm bath or a warm shower soon before bedtime. It helps you relax, it helps relax your muscles, and it's very conducive to sleep. If, despite doing all these things, a person still has trouble falling asleep, it's time to consult some kind of a sleep specialist. The most common way it's dealt with, insomnia, if it's chronic enough and deserves treatment, the most common form of treatment now is cognitive behavioral therapy. That's administered by a therapist of any kind, could be a rabbi, a priest, a psychologist, or a physician of any type trained in sleep. I want to mention a woman that I dealt with late in my active career life, who was a very successful businesswoman. She had been running a successful business for many years, but she told me that in the last 6 months or so, she had had this strange pattern of sleeping. She'd fall asleep, but she'd wake up 3 or 4 hours later and have trouble falling back asleep, and she could not figure out why. So we sat down over some coffee, and we went through her habits relating to sleep. It turns out that just before this all started, she had adopted a new way to help her fall asleep easily, and that was to take a nightcap. Well, a nightcap has some wonderful benefits. It does help a person fall asleep more easily. The problem is, by the time the liver has metabolized the alcohol, 3 or 4 hours later, the products of metabolism of the alcohol wake the person back up. So that's not the greatest plan for a sleep medicine. So what are the ideal conditions for sleeping? We'd like to have a room that's quiet. We'd like it dark. We'd like to feel comfortable, and that usually means slightly cool. We'd like to feel safe. We'd like to feel relaxed. And the timing ideally should be consistent. one of the most important things any of us can do to improve the ease of our sleeping is to set the time when we fall asleep and well, at least turn out the lights, and the time that we actually get out of bed in the morning, and make them fixed. If you're having no trouble with sleep, if it works fine for you, doesn't matter. But if you are having trouble, get up at the same time day after day and turn the lights out at the same time day after day. Your body has clocks, and the clocks are just as accurate as the ones on the bedside table. When I was about 15, I had a summer job that required my getting up very early. My family lived in a modest-sized apartment, and I didn't want to wake them up. Every morning, about 3 minutes before my alarm clock was going to go off, I would just put my arm over and put it on top of the clock, and as soon as I heard it go click, I'd hit the button and turn it off before it ever rang. That means that the clock in my brain was working just as well as the clock on the table, and yours can too. I'm going to show you the results of an experiment. And I know it's a funny looking slide, but let me explain. This study was done under the direction of an Israeli who moved to the United States and became a professor of sleep medicine and then a professor of medicine altogether. This study was planned by him, carried out by Spanish sleep scientists in Dubai of high school age girls. And the question that they were asking was this: is there any evidence that having a regular sleep schedule is truly better than something less than that? So how did they do it? They would write down a particular time on a particular day of the week for each girl. That was the time they chose to examine. And then they would write down for that girl, that moment, that day, they were either awake or asleep. And then they checked the same thing a week later. So they're looking for concordance. Were they asleep at the same time on those two separate days? Or were they awake at the same time? Or was there a discrepancy, one time awake and one time asleep? The higher the black bars at the left side, the less discrepancy there was between the two times. And they measured way more than two, but that's the idea. So when there's very little discrepancy, the black bar of the results is high up on the left side. Next to it, the longer one, lower down on the plot, shows those where there was more discrepancy. So the no means no discrepancy, yes means yes discrepancy. Now look at the right panel. Across the bottom is how many naps a week these high school kids took. Most high school kids don't take naps, but there was a correlation. The better their sleep correlated, two separate days a week apart, the fewer naps they needed. As the plots go down from the first one to the second to the third to the fourth, we move to the right. And the left-hand panel averages 1 nap a week. The far right averages daily naps. These are high school kids. That told me sleep regularity is really important. And that study just came out this year. So what do you do if you're more sleepy than you should be, in your own view? Probably you're correct, by the way, if you think that. So the first question is, do you have enough time in bed for sleep? And whether we like it or not, I wish I could move, but I cannot. Whether we like it or not, we all need roughly 8 hours a night. Some people need a bit more, some people need less. But all around the world, that's about the right number, give or take 1 or 2 for some people. And if you are having trouble being too sleepy, try what I said about the schedule. Make it your game to play for the next week or two, that you set the alarm clock same day, same time each day, and get up when it goes off. And that you turn off the lights to go to bed at the same time at night. And you should figure 8 hours between them. Okay, next, check for snoring or other interruptions in sleep. And here's where a bed partner comes in handy if you're lucky enough to have one. If you still don't have the answer, when you've looked at those things, then it's time to get help from a sleep medicine specialist. The most common problem is not enough hours in bed, especially in our society. The average number of hours spent in bed has decreased more than 1 hour per night over the last 100 years in our country. Nobody thinks that as a species we've changed much in 100 years. That's not likely. So probably there's one of two possibilities. Either our society was really greedy for sleep that it didn't need 100 years ago, or we are sleep deprived. And the answer seems to be the second one. I want to tell you about a man I met in New York in 1965. He was assigned to me to evaluate. He weighed 650 pounds. He was a 52-year-old bartender. He had been admitted to Albert Einstein for the 13th time in right-sided heart failure. He had fluid collected all the way up to his thighs, and he couldn't stay awake long enough to answer more than one question at a time as I took the history from him. He had a condition that at that time was called the Pickwickian syndrome, based on a novel that you know, the Pickwick Papers. We didn't understand it at that time. Subsequently, we have come to understand it, and we now know that that is a sleep problem. It is an example of obstructive sleep apnea. Well, what does that mean? This is a slide from the Cleveland Clinic, and on the left-hand panel, you see a person lying on the back, and the green is the air channel. Normally, the air channel starts with the nose and the mouth, and the air goes into the head, the cavities of the head, under the tongue, if a person's lying on the back, and passes then into the green channel. The right-hand slide shows the application of a CPAP mask. The mask is fitted over the face, either to cover the nose and the mouth, or sometimes it's just fitted over the nose. And the machine provides a very modest amount of air pressure that serves to lift the tongue enough that the air passage is clear behind it. And that can result in a dramatic effect. And Susie, would you tell the audience what your experience with it?
Well, I can. I don't want to break up your presentation. I mean,
Okay, would you rather do it later?
well, if you're giving me the time now, I set it up. Good, Ken.
Oh, you set it up, okay. How about setting it up now, and then we'll do it at the beginning of
Well,
the questions?
good, perfect. And I'm speaking into the mic. Yeah.
I apologize. Okay, so Susie will set up her machine when we get to the question period, and then tell us her outstandingly good experience with using a CPAP mask. So you would be entitled to ask, is sleep apnea important? Let's take a look at this curve. These are 4 different plots of survival over a 10-year period for a group of 80-year-old people. They had either no sleep apnea, that is to say normal amount, less than 5 times an hour, or, and that's the top black line, or they had increasing amounts of sleep apnea, obstructive sleep apnea, and those are the successive curves that are lower. The red one at the bottom is the most severe. So if we look at the 10-year mark on the bottom at far right, you can see that the black curve has about 84% survival in this 80-year-old group after 10 years. In contrast, the bottom curve, the red one, shows only about 75% survival at the end of 10 years. What that's telling us is that severe obstructive sleep apnea is a lethal condition. So it's important, and the question is, can we do something about it? And we'll hear from Susie. Time for me to shift gears. What about strange events happening during sleep? Limbs can move, people can kick, people can groan, even scream while not being awake. People can have seizures, either only during the night or especially during the night. And if any of those events is happening to anyone you know, it's time for them to see a sleep specialist. Evaluation in those cases always requires an in-lab overnight study with cameras rolling the whole night and monitors of breathing, oxygen level, heart rate, movement of limbs, and so forth. I want to give you a story about one of the people I took care of probably mid-practice here. This was a professor of nursing at UCLA whom I was seeing as an internist. And she came one day and said, you know, I woke up this morning with this terrible pain in my wrist, and I don't know how I got it. And it turned out she had a fractured wrist. And because I was being a little solicitous to be sure she wasn't being beaten up, I said, do you by any chance have a nasty boyfriend, a bed partner? And she glared at me and said, I don't have any bed partner. So I backed off, and we never figured that out. About 5 years later, she came back with a different pain, this time a hip. She had fractured her pelvis during her sleep, went back to bed, and woke up without knowing why that happened or how it happened. At that time, nobody knew what that condition was. As it turned out, a paper had been written about it roughly 6 months before I saw her, but I wasn't aware of that paper at that time. I now think she had a condition called REM sleep behavior disorder. In that condition, the paralysis that I mentioned earlier doesn't work. So the body is in REM sleep, having what can be very violent dreams, but the muscles are not paralyzed. That means that the Celestial Planning Committee in that individual has screwed up because the protection that she should have had, she didn't have. There's no other condition I've been able to think of that could explain that. The next slide reminds me to think about patterns and rhythm. I hope you're as amazed as I am about the ability of our body to change gears so dramatically as we go through the ages of life. Newborns are delighted to sleep whenever they're not feeding. If they're not feeding, they're sleeping, at least for the first few days and weeks. Young kids hate to go to sleep. When I tried to read my grandchildren to sleep, guess who fell asleep first? Teenagers don't want to go to sleep. They want to stay up till 4 or 5 in the morning and then go to school at 8. Doesn't work well. Working age adults seem able to take it as it comes. They can work whenever they have to. They wake up when they need to. They're able to fall asleep, the vast majority. And people in the age group that I am, and many of us are, wish they could do that. But it's not so easy. So think about that. The rhythm of sleep changes from sleeping all the time, more or less, as an infant, to not seeming to want or desire sleep in teen years to wanting to sleep but not being so easily able to do it in older years. Somehow the brain and the body is able to accomplish that over a lifespan of 7, 8, 9, 10 decades, in some cases 11. So does our sleep change with age? And I can imagine you're saying, is that guy kidding? We need the same amount that we used to need. That hasn't changed. It's just that it's harder for us to get to sleep. And why is that? Because we hurt. We have joints that hurt us. We have headaches. We have toothaches. We take medicines that have side effects. We get illnesses. We have worries, our own health, our family's health, our finances, their finances, and now for many of us, politics big time. And besides all that, we often don't have as much control over our own personal environment as we used to have. How about sleep and learning? The reason that I originally chose to include this as a topic is I read a book called The 100-Year Life, and our friend Sydney is a great example of that. Because people are increasingly living to age 100 and beyond, many people are not going to have enough money put away to keep them in reasonable condition and security that long. So clearly, people are going to have to work later in their lives unless survival changes. If people are going to continue working later in their lives in the next decade or 2 or 3 or 5, they're likely to have to continue learning because work is going to change. Work has certainly changed in our lifetimes. It's not the case that most work now it's not the case that current work involves mainly farm labor or factory labor. That's a minority of our employed citizens. So sleep is crucial to the ability to learn. Sleep loss produces attention loss. That's why sermons and talks, sometimes like this one, get boring, because we cannot pay attention. It's not that the talk is so terrible, it's our ability to pay attention. And the ability to retain new knowledge depends especially on stage 3 sleep, so-called slow wave sleep. Starting at about 30 years old, we began to lose that sleep. And by the age of 70, almost all of it is gone. I think in my last sleep study, I had something like 4% of my sleep was in stage 3 instead of the normal for a young adult of 25%. That means our ability to retain new knowledge overnight is half what it used to be. If you don't think I'm right, ask your kids. They'll tell you as mine would. And this problem affects all kinds of learning, whether it's reading something new, learning to play a new card game, learning to play tennis better, whatever it is, all the kinds of learning are affected. So it turns out to learn best, we need a certain amount of sleep, a certain number of hours before the learning exposure, and we need a certain amount of sleep, a certain amount of hours after that. One other thing I want to touch on. Weight loss turns out to be quite significantly affected by sleep sufficiency. Sleep deprivation causes increased appetite. My 650-pound patient was a perfect example of that. It's because our hormone levels change when we don't have enough sleep. And the hormones that cause increased appetite, called leptins, let me get it straight. the leptins and ghrelins change in their proportion in the blood, and they shift toward increasing the appetite when we don't have enough sleep. The second part of this, which is so terrible for a person trying to lose weight with inadequate sleep, is when they do lose weight and they're sleep deprived, the weight loss does not come predominantly from fat. It comes from muscle, just what they don't want to lose. So anybody who is seriously trying to lose weight needs to get appropriate sleep. I'm going to pass over the exercise, sports, activities definitely are better with sleep. You may have learned that one of the great tennis players before major matches would sleep 14 hours a night for 2 or 3 days before his major matches. Okay, so here's a summary, and then we'll go on to questions. We started late, and I can see we're ending late here. So if sleep is working well, just let it be. It's normal. It'll work on autopilot. Sleep is important, but you don't have to be a worrywart, because whatever the sleep problems are, there are specialists around who know how to help you. And they're available now in every major center, medical center in the entire world. And so it's now time for Susie to tell us, you want to get set up while we start with the questions? Okay. So Susie's going to tell us about her experience with using CPAP for obstructive sleep apnea. That one's live.
Ken, thank you. Really, I think, yeah. You know, I learned a lot, and I think what happened, people picked up pieces that maybe they didn't expect to hear. I certainly did. I want to say, working backwards quickly, that I was a very average student from day one, grammar school, through college. I now am an A student. I really mean it. I am. My memory, thank you for saying about memory. I read 2 newspapers. I take in what I read. If you ask me a half an hour later, But right, Ken? That's okay. But I'm so interested in what I'm reading and I'm thinking. I'm working it. Okay. And it wasn't, Wally husband will be gone 16 years this week. He had a overnight caregiver 16 years ago who said to me in the morning, you snore. You snore. I hadn't a clue. I looked at Wally, who looked so sheepish. If you knew Wally, he would never criticize anything. A 50-year marriage, he had lived with a woman who breathed heavily, sometimes snored, never, ever criticized me. Well, I didn't go to the sleep doctor right away. I can't remember why, but I went to a sleep doctor, and my dear friend Pat Cohen is going to the overnight test tonight, if I'm right, in order to qualify for the machine which I brought. You do have to have, and you're rigged up, I think you referred to it, they put electrons in your brain and all over you. I probably, during the night, maybe slept 20 minutes, maybe an hour and 20. I think that they didn't need a lot of time testing to realize I had a lot of interference with my sleeping. Ergo, the government pays for every bit of the machine. I get a call every 3 months. Is your equipment sufficient? Do you need more? And it makes a happier person, a healthier person, and I still play tennis and pickleball and all that. But the point is, I'm happy, and I'm alert. Enough of this. So alert that I should cut it. But let me show you the machine, if Ken.
I think I'll start with the questions while you put the machine together. Is that okay? Well, set it up then. Yeah, put it on and people can watch. I think we should go ahead with question. Yeah, Nan,
Hold it, Jan. Nan.
there's a microphone coming to you.
When you talk about naps, they say that your nap should not be more than 20 minutes in the afternoon.
That's the ideal, and the purpose of that statement is some people, if they nap longer than that, will have trouble falling asleep at their usual bedtime. If you take naps that are longer than that and you don't have trouble falling asleep at your usual bedtime, it's fine to do that. That's the main reason. Sure. Arlene. I'm sorry. Oh, yes.
Okay. By the way, I don't nap, and I get 7-8 hours of sleep all night.
And I think you can see how much distress she's in. None. Thank you. That's great, Susie.
Could you say more about what this process is?
Okay, so this is the CPAP machine. This is a small pump that pumps a little bit of air through this tubing up to the nose mask. And Susie's able to keep her mouth closed.
I do.
Ah, okay. All right.
This, if you'll hold it.
So some people have trouble keeping their mouth closed at night, and the pressure will blow the mouth open.
Right.
In which case, Susie puts on her chin strap.
I find it imperative. If my mouth opens, I've lost it.
That's not true for everyone, and that's terrific, and that's all there is to it. That helps the sleeper keep the mouth closed so the air doesn't leak out through the mouth. And you can hear, or at least I can hear, there's no leak.
Oh, is that what you'd listen for, a leak? And
Yeah.
so that keeps the chin up and closes the mouth.
Exactly.
Oh, okay. She loves it.
Thank you. Thank you very much for bringing that. Question.
Do you have trouble getting used to it? A good question. Yes. And statistics, over half the people who are given this quit. That's the best question. It took me almost 2 weeks, but I went into it with a very positive mind. And it might take a month, right, Ken? Or 6 weeks. I tell people, please stay the course. During the night, why am I doing this? And I might wake up more. No.
A study was done at the University of Pennsylvania Nursing School about how to help people stay the course. And the result of that study was early questioning about how it's working. So if the medical office that provided the CPAP machine contacts the user to ask if they're having any trouble, and then helps them solve the problems if they have any, it makes a huge difference. And then people are successful, as we see. Yes, Arlene. Okay, I didn't realize.
Ken, I'm just curious about this. You showed the three stages of REM. I thought all this time that REM was a period of dreaming, but is the REM, are those three the whole period of sleeping altogether?
Yes. During the night, we cycle through these various stages of sleep. Stage 1, which is very light sleep, is is a very short period of time, generally a minute, 2, 3, 4 minutes, and then we fall into stage 2 sleep, usually. Sometimes we fall from stage 1 into REM. But REM overall, on average, occupies about a quarter of the night. And during that quarter of the night, we're actively dreaming half of it. We are also dreaming in other stages of sleep, but there are different types of dreams.
I have two questions. One, I've been seeing on TV, they advertise some kind of internal sleep apnea situation. I'm not sure how to describe it. And secondly, I dream excessively almost every single night of very strange situations. Is that a typical kind of thing, or is it some people remember, some people don't, or can you comment on that?
It certainly is correct that some people have dreams and do not recall them. I rarely remember any dream, and there are many people like me. And one of the evidences that people use to argue that dreams are not really very important is that people who don't recall their dreams seem to be perfectly healthy anyway. So we don't know what importance they really play. Dreams do occur throughout the night, not only in stage REM. They are, as I mentioned earlier, non-REM dreams are different from REM dreams. The best study about that has come from Harvard, from a guy who spent 20 years studying the difference. He would report that REM dreams are colorful, very active, they're chaotic. They can take place in this room, and then in the next scene, they can be in Hong Kong. And we don't get disturbed in the least by the fact that our awareness shifts from Los Angeles to Hong Kong in the flick of a second. It doesn't bother us at all. He would say, in that situation, what's happening is our brain is acting in a psychotic way because things that we know aren't true are happening in our dream. Things that we know can't happen are happening in our dream. It doesn't bother us at all. We're not aware of that. So that's the difference between REM and non-REM dreams. Non-REM dreams tend to relate to what's happened in your life that day. And they tend to be non-colored, they tend to be less action, they tend to be negative in tenor. The tone is often negative. Somebody bothered you, the way they said something, or something of that sort. I think that's all I will say at the moment. Yes?
Okay, hold on.
Oh, I'm sorry. Okay.
Hi, thank you.
Sure.
So would you address interrupted sleep? I find that I get up during the night a handful of times, sometimes to use the bathroom, sometimes not. And I don't know if that's, a sleep deterrent or it's just sort of what happens at this age.
It actually simply depends on how easily you fall asleep again. If you fall asleep again easily, it's not important at all. Think of the poor guys with a prostate gland. Most of us who have a prostate have got to get up multiple times every night. And so long as we're able to fall asleep again easily, it doesn't interrupt our sleep. There are a few clues. Number one, if it's not necessary, don't turn on the lights. Number two, if it's not necessary, don't flush a loud toilet. Number three, if there's anything else you don't need to do other than going right back to bed, don't do it. Just go right back to bed and assume you're going to be out like a light. Yes.
Would you speak to technology in bed, before bed, and its effect?
Yes. Light tends to defer sleep. And the most powerful light is blue, because that's the highest energy wavelength. When we use portable phones, iPhones, or we use a tablet, or we turn on the television right before sleep or keep it on, we are tempting fate, because the light emitted by those devices tends to prevent melatonin from being released, and that can defer sleep onset. Yes, Sid. Oh, I'm sorry. Excuse me,
I would like to address again this waking up in the middle of the night. I find that it just started like 6 months, a year ago. Up until then, never an issue. Now getting up to go to the bathroom, let's say, I don't look at lights, I don't look at my clock, I stay focused on the dark, get back into bed. Sometimes I go right out, and sometimes I can lay there for another hour and a half-ish, because I hear a clock every half hour donging. Is there a way to realize ahead of time? Is there something I should do, not do? Do I drink? Do I not drink? I never had an issue with having to get up and go to the bathroom before.
Just one question. Is it interfering with your life during the day?
If it's a long night where I couldn't go back to sleep, then yes, I'll wake up and be out of sorts. But not every day, but enough
Yeah.
to be aware of.
I mean, we human beings are pretty complicated characters, and our lives have so many variables from day to day. It's hard to generalize, at least for me, for something that's going on intermittently and without obvious pattern. I would just mention one thing. It may be that you're actually getting more sleep than you think, even though it seems like you're awake for a very long time. Let me explain what I mean by that. Before I stopped seeing patients at the Cedars-Sinai Sleep Clinic, I met a man who was an architect, pretty prominent, and he came in with a complaint that he had not slept for almost 3 months. Well, I knew that was wrong because he would have been dead if it were true. So he had an overnight sleep study, and the next morning I interviewed him with the results in my hand. I asked how he had slept the night before. He said, you know, I slept pretty well. I think I slept a whole half of an hour. And I said, well, that's strange because the laboratory says, based on your brain waves, you slept 5.5 hours. And he burst out into 4-letter words. He thought Cedars was crazy. I finally persuaded him that was not true, because there is a thing called sleep state misperception. And there are a sizable number of people who have that and think they sleep a lot less than they really do. It turns out that it's not so difficult to understand now, but it was 2 years ago up until then. A normal person recognizes they have been asleep if they have been asleep for 20 minutes, not till then. A person with insomnia doesn't recognize they've been asleep until they've had 30 minutes of sleep. And a person with sleep state misperception doesn't recognize they were asleep until 40 minutes of sleep has passed. So if a person wakes up, let's say every hour, it would be possible for that person to say, gosh, I don't think I slept at all. But in truth, they did. So I don't have an answer specifically for you, but I think there are possible explanations. If it's urgent enough for you to need help, you could get a sleep study done. I don't know who's next. I think Sid.
First, I want to say that I'm delighted to tell you that Ken and I are good friends. Okay, how about now? And I've had the pleasure of seeing him working intensely over a period of many years to put together this book, and all to our benefit. So I want to thank you for myself, for everyone else, for your knowledge and how you can convey it to us and come here to us. I want to make maybe some personal comments. Go over and back from the concept of naps, which drive me crazy because I've tried to nap and I find it almost impossible. And I have friends, close ones, who would, if you interrupt them, would be very unhappy because they nap every time, and usually at the same time. So I never figured out why I can't nap. And I hope other people
Steve,
will
could you
comment
put the
on that.
microphone closer? Put the microphone closer.
Okay, let me make a couple of other comments. Anyway, everyone knows we see lists in the newspapers, magazines. What should you do to live a long time? The concept of sleep is in every list. The importance of having a good life is in every list of these places. I'm lucky. I fall asleep almost invariably very, very quickly. But I have something, maybe others have it. I have a clock next to me. And when I go to sleep, I look to see what the time is. And when I wake up, I always look to see how long I slept from time to time. So that if I get to bed at 1 o'clock and I wake up at 1:45, I'm very upset. I only slept 45 minutes. But if I ever go to sleep at 1 o'clock and I wake up at 3, I say, oh, 2 o'clock is not too bad. So I go through this every night. I know people time it also. So when you say you should have 8 hours of sleep, I assume that means collectively when you add it all up.
You bet.
I also find that I had a good day before, I fall asleep immediately. I still wake up only an hour later, rather than 3 to 4 hours I would have thought. I was very calm, I wasn't excited. Why didn't I sleep longer? I suppose my upset about not sleeping longer keeps me from sleeping longer. So I have these. But I heard what you said, and with people's questions, I think they're all right to try to absorb your points, and I want to thank you for all of that.
Sid, our friendship is my honor.
So I have had some unusual sleep behavior. Can you hear me?
Yes.
Okay. And my two sisters and I would often, every year we had a sisters' weekend together. And often we would either sleep in the same bed or we'd always be in the same room. And they said that not only did I laugh in my sleep, I sang in my sleep, but they couldn't figure out what it was I was singing. And I told my husband that, and he said, I've never mentioned it to you. This was before he had his sleep apnea machine. And he said, you do that all the time. And I had no idea. The other thing that was not mentioned, I'm pretty good at judging about 5 days before the moon becomes full. And that's when I wake up most of the time and I cannot go back to sleep. And it's not even shining into the bedroom. My body, I feel like I'm guided by the moon.
I think we need a necromancer here to help understand that, and I'm not that one. I will tell you about one other patient that I had who was quite interesting. This was a man who was in his 60s, I believe, and married to a woman for 30 years or so. Every night, about midnight, the wife would let out a blood-curdling scream, roll over, never wake up, and stop. She wouldn't scream more than one time. And they said, it's affected our life. We can't go to a hotel. We're afraid they'll call the police. We can't visit with our friends overnight. We're afraid we'll terrify them. And I never figured out why it happened, but I'll come to that in a second. But I was able to treat it successfully. I used a small dose of a benzodiazepine, and the problem disappeared. The reason it probably happened, and this is speculation, is that we know that different parts of the brain can be in different stages of sleep at any one moment. So that a person can be having REM dreams, but the parts of the brain that are supposed to block muscle movement aren't working. They forgot. So that's what produces REM sleep behavior disorder in my patient who fractured her pelvis and her wrist. And there are other strange dissociations of what's happening in one part of the brain compared with another. People can have seizures that occur only in the sound portion of the brain where we recognize sound. Thank you. So a person can wake up hearing a symphony and maybe loud, but the rest of the brain is asleep. So there are things like that that do occur. After all, the thing that we've got up here is a massively enormous computer. And in that sense, it's really no surprise that it can do things that we can't understand. I just want to add one quotation, which you'll find in the book. A neurologist wrote that if the brain were so simple that we could understand it, we'd be so simple we couldn't. Yes, Barb.
Have there been studies about sleepwalking and where the, how the brain figures in to sleepwalking?
We do know that parasomnias, and sleepwalking is so-called parasomnia. We know that they occur because one part of the brain is not at the same stage of sleep as other parts. So the ability for the motor cortex on the left side of the brain to function while the rest of the brain says is just part of the game of different portions of the brain being in different states at any one moment. I didn't respond to your question, Arlene, about devices and helping prevent sleep apnea. There is now an implantable pacemaker, much in the style of a cardiac pacemaker, but this one attaches to the genioglossus muscle. And if you remember the slide that I showed from the Cleveland Clinic, the tongue is held at the front edge of the lower jaw. There's a tendon that, and a muscle actually, the genioglossus muscle pulls the tongue forward so it does not slip back when we lie on our back while we're awake. But the moment we fall asleep, the genioglossus muscle relaxes. And so the connection between the tip of the tongue and the back end of the jaw stretches out and the tongue flops back. The pacemaker that works on the genioglossus, there is such a thing, and there's another pacemaker stimulating the diaphragm. I believe there's a third one that opens up the upper airway, not only the genioglossus muscle, but also the soft tissues around the oropharynx. I'm sorry that I've never actually experienced that, so I don't have a whole lot of information. But they do seem to work well for any but very severe obstructive sleep apnea.
Have you talked with anybody about this implant? Is it an implant?
Yes, it is.
And do you, is it more information? we
I
can
have
gather?
not personally spoken to anyone who has used them or put them in or experienced one, so I'm afraid I'm not the best source for that.
That's an interesting, I haven't seen the ads, the promos, but interesting as opposed to doing the machine.
Yes, Susie.
I was told as a youngster, sleep before 10 p.m. counted double. Was that a way to get me to go to bed?
We must have had the same junior high school chemistry teacher. I honestly don't know how much reality there is to that. I suspect because kids have to get up at the regular time in the morning for school, no matter what, urging them to go to sleep before midnight was a way to try to guarantee they got enough sleep. Yes, Nan. Okay.
Okay, these are 3 quick questions, okay? So I'll say all 3, and then you can take whatever you want. Okay, one is, if somebody falls asleep, say, during symphony, is that regenerative? Or is that, does that count? That's, thank you. That's one. The second one is jet lag. And the third one, okay, wait, it was something someone just said. Okay, oh, yes, I got it. Okay. When people get a second breath, like in the afternoon, late in the afternoon, when you feel your blood sugar starts to drop and you say, I just need to take a quick nap. And then you get a second wind and you say, I don't need a nap. Or you're tired and you want to go to bed at 10 and all of a sudden it's 11 and you're raring to go. So what, okay, those 3.
Okay, let's talk about that one first. There are 2 cycles that control when we're sleepy and when we're awake. One of them is simply the passage of time since we were last asleep. The longer it has been since we were last asleep, the sleepier we get. That's one factor. The other factor is, as we stay awake, our body secretes a chemical that collects. And the more there is of that chemical in our blood, the sleepier we get. So a nap does restore us. Even a 10-minute nap is quite restorative. If you're ever caught driving somewhere and you're sleepy, it's wise to find a place to pull off and give yourself at least 10 minutes to fall asleep and then wake up and drive on. You may save your own life. Let's go back to the other 2 questions. The first one was what?
Okay, the first one was if you fall, jet lag, the one you just answered about if you fall asleep, like during Philharmonic.
Oh, yeah.
And the third one was.
Yeah. Okay, so let's talk about the Philharmonic experience. I don't know of any reason why sleep at a symphony would not be effective sleep. Obviously, it does depend on how deeply asleep one gets. The most restorative sleep, well, I'm not sure anyone knows the answer to that question. No, and it's hard to get at that question because it's hard to control what stage a person sleeps in. We really can't do that. With one exception. Some Swiss investigators about 2 years ago tested adults with a rocking bed. And a rocking bed, just as if it were an infant. And they found that adults did fall asleep more quickly with a rocking bed, and it increased the amount of delta sleep they had. So that's the one example that I know of where any intervention can affect what kind of sleep a person gets. But most of us don't carry a rocking bed around with us. So how much value that's going to have, I'm not sure. But yes, I believe that sleeping in the symphony will count as sleep.
Even if your head keeps bobbing?
What that probably means is you're not very deeply asleep and something is waking you back up. It may be that you're getting obstructive sleep apnea as the head comes down. I'm not certain of that, but it could be that. Yes, of course.
I am one of those who nap pretty much every day now. And what puts me to sleep is listening to either a podcast or a book, sometimes music, but mostly it's the sound of voices. Of course, I have to go back to where I was before because I will have missed something, but you do that too? It just works beautifully for me. You
know, Debbie, I don't know why that works, but I'm aware of it. I suspect that as we get sleepier from the relaxation of that activity, our eyes are trying harder and harder to stay open, and that probably adds to fatigue. I don't know of any other magic that's happening there, but I think a lot of people have that same experience. So,
I just have one question, and that is, because I do sleep pretty well, but I have a sleep function on my watch, whatever they call it, Apple Watch. Apple stock is way down. But anyway, for those of you who care, how accurate, and I wear it every night because I'm curious to see, do you know anything about this function and how accurate it is?
I know that they're considered not very accurate, but I can't tell you details because I don't know of anyone who has actually compared the results of the iWatch to a polysomnogram in a sleep
Yeah,
lab.
I would think, because it's measuring basically your body temperature, your respiration rate, and your heart rate. And so I think it's based on that, although the other functions, medical functions on the Apple Watch, such as the EKG, if you have one with an EKG, are very accurate. And I would think that if they put it in, I mean, it tells you how many minutes you're in REM. I have it from here.
That's not very reliable. The problem is nobody wants to fund such a study. Susan, nobody wants to fund such a study. The people who would naturally want to do it would be the Apple Watch people, but they're afraid that the result will be that it's not very accurate, so they don't really want to take that risk. And I think the reality is, for sleep, it's not very good. I send your husband samples of my EKG more often than he wishes. That part works well.
I have to say, it helps me since I got this watch, because it tells me how much sleep I've had. I mean, and whether I think it's correct or not, that's pretty good, okay, good.
If it works, that's great. Yes, please, Barb.
So, my question is prefaced by a statement. I maybe nap 4 to 6 times a year, but often I put my feet up. I don't have a book around. I don't have anything else around. But I find that putting my feet up and resting is restorative.
And who's surprised?
And who's surprised? Me.
There's a question here. Why don't I give you my...
The opposite. I hate to take a nap because when I wake up, I feel so heavy and so out of it that I just don't like taking a nap.
Are those long naps?
Too long.
I don't know. I have no clue. I just know I wake up and feel so
I can tell you this. If you're waking up from delta sleep, there is a thing called Schlafkrankheit. And what it refers to is the lag in the ability to wake up from delta sleep. So if you are getting into that deepest stage of sleep, it's natural that you would wake up very gradually. I have a son who was unable to wake up with his brothers and me in the morning to go on ventures because he was always seemed to be arousing from delta sleep. It took him 10 minutes to even know where he was, more or less.
Ken?
I'm sorry.
Yeah, we
Yes,
didn't talk about bedding. The bed that we sleep in, the mattress. I just have a topper put on mine. Mattresses are a very important, and pillows. I don't know if you want to talk about it.
I don't know what to say because I don't know of any such evidence,
Oh,
but maybe you do.
well, evidence was I would get leg pains, body pains, and I think attributed to my sleep equipment.
Heads up. More?
Somebody had asked earlier What about jet lag?
Nan, could you explain, what do you mean, what is the question about jet lag?
About jet lag? Well, when you change your, with the new, when
Time
you
zone?
travel to Europe and that's 8 hours and your whole body gets cattywampus, how do you either mitigate the problems of jet lag so that you get on a quick rhythm and nurture your body with sleep, or, you know, what do you do?
It's a difficult problem, and there's no magic. And the reason there's no magic is that the internal clocks that we have depend on a whole series of biochemical reactions. And while each person has a slightly different normal day length, most of us are a little more than 24 hours. Some people are 24 hours and 20 minutes. Some people are 24 hours and 12 minutes. And that's nothing we can change. What we can change is what we do in relation to the time zone change we're about to have. And that depends on which way we're going and how far we're going. Let me tell you about one young man, a businessman in his early 40s, who had to go from home in San Diego to business conducted in London or even Tel Aviv, and then he had to fly back and hop through Los Angeles to Tokyo. And he had to be very careful because he was making business contracts, and if he screwed up, he would lose everything, or could. Ultimately, he and I went through the possibilities and decided the best thing for him to do when he got on a flight was to calculate how many hours was it before he wanted to be asleep at the destination. And if it was an hour from the time he boarded, that's when he would take an Ambien. So he would fall asleep right then and there, or very soon, and be immediately as close to adjusted to the new time zone as he could get. There was no way to make it work better. And he did the same on the return flight. So that's an extreme example, but it's the same problem. It turns out that we work better adjusting to the new time zone when we fly west. Flying east is harder for us. But that technique should still work to some degree. I can't promise it'll work perfectly. Sid, do you want to?
All right. I may have asked before. I feel
Put it closer.
normally I will fall asleep right away. Let's assume on the night everything is fine. I fall asleep. I wake up in an hour, and then I find I'm wide awake. It's not just casual awake. I'm wide awake, trying to think, how can I now fall asleep again? Often takes me a while before I get to sleep again.
My first comment is, you have an enormous élan vital, the vital force. That's why you've had such a successful and long career. And I don't
And
think you're
life.
going to be able to change that. I think you simply have more energy within you than most people have. And I can't explain why you would wake up in an hour as opposed to 3 hours. I can add this one thing, and it's probably
And we're
not
going to
e-
close with this.
Okay. It's probably not right on point, but it's interesting too. Women complain much more of insomnia than men do. But objectively speaking, women sleep better than men. Go figure that out.
Well, that's a good way to end. Ken, you know, it's never about the numbers. It's not. It's about the quality. And you certainly exemplify that with us today. And thank you so very much. I know you have some books with you. If there's interest, there's you, I will help. And we're going to put, Daisy's going to help too. Thank you, Daisy. Okay, so, and there's enough food to pick up and have lunch, you know, a little, there's cheese, there's a little protein, there's some fruit. So please help yourself, and this felt like a study session. This is good when you all get chances to ask and re-ask and think about it the best. Thank you, Ken. This was wonderful.